Thank you for spending this time with us here. I'm going to get us started with introductions. Welcome again to today's Alloy Live. We're talking about Black women's health through menopause and beyond. There's a lot to get to. First, I want to welcome Dr. Uché Blackstock. Dr. Blackstock is a physician and thought leader on bias and racism in healthcare. She is the founder and CEO of Advancing Health Equity and appears regularly on MSNBC and NBC News. Dr. Blackstock is also a former associate professor in the Department of Emergency Medicine and the former faculty director for recruitment, retention, and inclusion in the Office of Diversity Affairs at NYU School of Medicine. Dr. Blackstock is the author of the generational memoir,
It's upside
Legacy of.
down.
Oh, thank you. Is it?
Oh wait,
Is it
maybe.
up?
Oh,
It's
It's in
just
reverse.
reversed.
It's a
It's just
oh,
mirror thing.
reversed.
It's a mirror thing. I'm so sorry.
oh. No, it's
Legacy, a
okay.
Black physician reckons with racism in medicine, which was also named an Amazon Best Book of the Year. And also with us this morning, now I have to hold your book upside down, is OBGYN Dr. Sharon
No,
Malone,
No,
New
it's
York
upside.
Times.
It's turn it
Is
upside.
it?
good.
There
Is
you
it?
Yeah,
go.
yeah,
There you go.
yeah.
New York Times best-selling author of Grown Woman Talk, which was also just named CBS ranked reader favorite book of 2024, an NPR staffer roundup of best nonfiction books of 2024. Dr. Malone is chief medical advisor at Alloy Women's Health, and together both of these women are steadfast and perseverant in their commitment to ensuring health equity, access, agency, and control over one's health across a lifetime of all patients, and particularly as we speak about today, Black women. Thank you again. Welcome to both of you. So to begin, you both have several things in common. You're both Harvard Medical School graduates. You're both mothers. You are both sisters, not each other's sisters, but you are sisters. And you both sadly lost mothers at early ages to cancers. I know from reading your books and certainly in having conversations with you, Dr. Malone, that this event, this tragedy largely informed you both as professionals, as parents, as advocates. And I wonder if you each could share a bit about your mothers. Dr. Blackstock, if you'd like to
Oh,
start.
sure. But first of all, thank you so much for having me. I'm so excited for this conversation, and then also just to have it on Juneteenth makes it even more meaningful. I know my mother, I feel like she's larger than life. I think, her memory lives on, and she was probably like my most major influence. Just every step of the way, she had a very different upbringing than I did. And I talk about in the book how she grew up not far from where I am right now in Brooklyn, but living in poverty on public assistance, born to a single mom. She had five other siblings and just had a very difficult life, really, really difficult life, but was determined and had the fortune of having a mentor in college that looked out for her, a chemistry professor who encouraged her to apply to medical school, and she did. And got into all her medical schools, ended up at Harvard Med, and could have gone anywhere after that, but came back to Brooklyn to practice in the same neighborhood in which she grew up. And so that was a very strong message to me, starting from a very early age. And also the work that she did with other Black physicians and Black women physicians. I always talk about how for a very long time, I thought most physicians were Black women
Yeah.
because that's all I saw growing up.
Yeah. Thank you for that. Thank you for sharing that, Dr. Malone.
Well, thank you, Rachel, and thank you, Uche. I'm so happy that we are finally having this
I
conversation. We
know.
got to meet in real life
Yes.
about a month ago, so I've been waiting for this for a while. But, we do have a lot in common, and I will correct one piece of the record for you, Rachel.
Please.
Uche went to Harvard Medical School. I went to Harvard College. I went to Columbia
Thank
Medical
you.
School. So I have to
Columbia
give
Medical School.
PNS the shout out,
I
Yep, yep.
yes,
So, but
forgive
but we're
me.
still we're both Harvard
we're,
College,
You
Harvard
are,
we're
undergrad.
still both
I
Harvard
Yeah,
College.
yes,
apologize. Thank you
yes,
for
That's
that.
yes.
okay.
Thank you.
But and it's funny about, how much our mothers loom large in our lives because, I lost my mother when I was 12. So I felt like I have both the memories of the mother that I had for those, 7 or so years that I actually have memories of her. But I also have the imagined relationship with my mother because there's
Mm,
so many things that she was not there for that I wish that she had been able to see. But my mother was that woman that, she was actually a couple of generations, even, you know, above me because she was much older when I was born. And I'm the youngest of 8 kids. And she was the type of woman that was very wise, very smart, and really an example of the wasted potential because, she was born in Alabama in 1914. And even though she probably was as smart, if not smarter than me. The opportunities that were given to her were so few. But I had also the good fortune when you're the youngest of 8 kids. My oldest sister was my surrogate mother after my mother died, and I lived with her until I got to be an adult. And it was the same thing to see two ends of a spectrum. What was a life lived that was not fully
yes.
that did not live up to the potential, and what was another life when you got to see a different thing. So yes, our mothers are always with us, either physically or spiritually, for the rest of our lives.
Thank you so much for that. I want to take a step back or sort of higher, and get into the broader sort of higher view of medicine and its shortcomings. You both have seen this from, as someone who has lost someone in or several people in this medical field, as someone who has treated patients and someone who has been a patient. And I'm thinking about sort of the shortcomings of medicine, the calculated and intentional aggressions on the bodies of Black people, and how that has impacted generations of Black men and women in this country. Just to sort of tick off a few, and Dr. Blackstock, you mentioned these people by name also in your book. I'm thinking of Dr. Thomas Hamilton, who sought to prove that Black people had thicker skin than white people and therefore were less susceptible to pain. The Tuskegee syphilis study, which injected and then withheld treatment for syphilis to see how it would play out in the bodies of Black men. Dr. J. Marion Sims, known as the father of gynecology, who performed experimental operations repeatedly on Black enslaved women without consent or anesthesia. So sort of carrying that medical history through time and then conflating it with systemic examples of racism in housing, in education, employment, homeownership, environmental racism, food insecurity, and so on. All of this has resulted in a distrust of the medical establishment. But something else happened that I never knew about, Dr. Blackstock, that also contributed to this distrust. And that's a report known as the Flexner Report. And I wonder if you could share about that and sort of its impact on, in this case, Black women in particular.
Sure. I thought it was very important to talk about the Flexner Report and legacy because it was something that even myself as a practicing physician, I didn't learn about until after medical school, after training. And so I talk about this process of unlearning and relearning. And so I had heard of him because there actually was, I think, an award that the AAMC, the American Association of Medical Colleges, named in his honor. So I knew about him, but I didn't know all of the history. But I also thought that it was important because a lot of times in 2024, we're making these observations. Why are we seeing these horrible statistics, not just in patient health, but why do we see so few Black physicians?
Right.
And a lot of times you look at the statistics and there's this inference that there is something wrong with us, like there's something, either biologically wrong with us as patients or something, neurologically, cognitively wrong with us as people, that we can't become, physicians. And I thought it was important to talk about the Flexner Report because just like so many other policies that we have in this country, whether they are federal or organizational, that report, by Abraham Flexner, who was an education specialist, and who was actually commissioned by the American Medical Association and Carnegie Foundation to assess all 155 U.S. medical schools in the U.S. and Canada, compare them against Western European schools, as well as Johns Hopkins. It actually led to the closure also of some predominantly white medical schools too. So I always want to make sure I mention that. But at the time, there were very few. In the early 1900s, there were only 7 Black medical schools. They had educated about 1,500 Black physicians by that time, by 1905, and they were really doing all the heavy lifting of educating our Black doctors. But that report, because of the legacy of slavery, of generational wealth or lack of generational wealth, our HBCUs didn't have the same resources or endowment as predominantly white schools, and so unfortunately, that report led to the closure of 5 out of 7 of the historically Black medical schools at the time, leaving behind only Howard and Meharry. And so fast forward in 2020, there was a study that came out that showed that if those 5 schools had stayed open, they would have educated between 25,000 and 35,000 Black physicians.
It's
That
incredible
is
to sound.
incredible.
Yeah,
Yes,
yeah,
I mean, and thinking about the impact of those physicians on our community, and just like Dr. Mullen said, like just that lost potential. Those people,
yeah,
all of those people who could have contributed not just to patient care, but to the field of medicine,
yes,
to research, to
yeah.
be mentors. So, and that's why one of the reasons why today, in 2024, the less than 6% of physicians are Black, and so I want us to think about that when we think about the SCOTUS decision last year on race-conscious admissions, what the domino effect that's going to have in higher education and health professions education. So we really need to be aware of this when we're thinking about, taking action and how do we counteract these policies that have been so harmful to our communities.
Thank you for that. Dr. Malone, I don't know if you wanted to add
I do.
anything.
I think that that's the common thread here is that we have to realize that how much of our healthcare was influenced by the racism that was inherent in the system. I mean, medicine was not exempt from the same sort of prevailing thought that, everything else was happening in America. And it's funny, it was only when I was doing the research for my book and I realized, I said, wow, I grew up next door to 2 hospitals. What's that about? I
Mm,
mean, literally next door to 2 hospitals. And I found out that 3 blocks in the other directions was the first medical school in the state of Alabama. And it was founded by this guy named Josiah Knott, Dr. Josiah's Knott. And this was in the 1850s, and he actually went around the country lecturing on the inferiority of Black people and why it was based in science. It wasn't just his opinion, because you've probably seen these pictures where they were measuring Black people's skulls, where they would
yes,
actually say, well, of course, because their cranial capacity is different. So therefore, I mean, this is how medicine was really started. We were not just saying this, in the abstract. They were actually sort of coming up with this pseudoscience about why Black people were inferior. And that prevailing notion in medicine, that's how it started. That's how, I mean, you talk about J. Marion Sims. Now, I'm a gynecologist.
right.
I did not really know who J. Marion Sims was until the Charlottesville riots, when they started talking about taking down the memorials.
Mm,
No idea. I mean, so there's so much about the history of medicine that we're not really aware of, but we bring that history forward because Dr. Blackstock and I know that there are many things about what we are taught. I mean, and we're talking 100 years later, and we're still taught some of those same things,
yeah,
those same misperceptions about Black people, health, how we react, the fact that residents still think that Black people feel less
yeah.
pain, all of these notions that we bring forward. And we at least have to acknowledge them before we can knock them down.
Thank you for that. Dr. Malone, so many listeners today are women over 40, Black women over 40, those in perimenopause and menopause, who, should their mothers have been fortunate to live long enough, went through it and probably didn't talk about it. Considering all the aforementioned disparities, I want to focus for a bit on menopause and how the inequities that we're talking about today manifest specifically for Black women through perimenopause and menopause.
Um, You know, it's funny. Dr. Blackstock and I both were not fortunate enough to have, to have experienced this part of our lives with the benefit of our mothers. But,
Right.
as I was telling you earlier, Rachel, I don't think that even if my mother had lived, we still wouldn't have had this conversation because
Right.
we didn't talk about it. We don't talk about it intergenerationally, so we don't have the knowledge moving forward about what to expect in this really important time in our lives. And not only do we not talk about it intergenerationally, but we don't talk about it amongst ourselves.
Mm,
And therein really lies the problem about, as we enter this phase of life, not knowing what to do, not knowing when and how to access care. And I think that there is this prevailing notion, particularly for women in general and Black women in particular, where we have just normalized suffering. So when we get to this phase of our lives, there is it's just one more thing in the long continuum of suffering that women have endured, from periods to PMS to,
mm,
postpartum depression. It goes on and on. So this is why I think that it is so important that we have this conversation. Dr. Blackstock and I are of different generations. And, I want to make sure that her generation doesn't come into this, important and the rest of your life,
yes.
not knowing the things that we need to know and how to access care.
Thank you. Dr. Blackstock, to that point,
Hmm.
um, this is a little personal, but we're going to get
Yes,
into it.
yes,
I am wondering, as a physician and as a patient, as a woman in perimenopause, how
yes,
is it going? How is it going for you? And do you feel prepared? Because we speak about this a lot as well, sort of in the margins,
yeah.
about medicine specifically not speaking about and educating future physicians about perimenopause and menopause. And so I'm wondering for you, a Black woman, a Black physician in perimenopause, not only wondering about your feeling of preparation, but knowing that the experience of Black women is more severe in various ways. Could you speak about that?
Oh, sure. Yeah. And I'm also an open book, but
We love
what I would
open
say,
books.
no, what I would say is, of course, you would think as a physician, I would be prepared. I am not prepared, which is why Dr. Malone's book is so incredibly
Yes.
important. And I was just like, I can't wait to read this because there's so much I didn't know. Because, for example, like over the last 2 years, my period has become irregular, right? And I wasn't sure why it was happening. I wasn't sure. I'm like, am I perimenopause? So I ended up having to go to. I have actually an OBGYN. I'm sorry, an NP as my who cares for me for my OBGYN issues, and so I had to go to her. But like, I literally was like, what is going on? Why am I not? Why am I missing my period? Is something else happening? And I honestly felt like a layperson. I
Mhm.
felt like I didn't have the information that I needed. And then some research, I just started doing some more reading on it. And come to find out, I didn't recognize that Black women that experience perimenopause, right before I read Dr. Malone's book, but experience perimenopause earlier than white women and other women of other racial backgrounds. And a lot of times, those symptoms are kind of dismissed because of physicians may say like you can't be in perimenopause yet. So
Right.
I feel like again, this is a whole area that I am trying to learn more about, and I'm so glad that there are physicians like Dr. Malone out there writing about these issues. And then I follow Tamsin Fadal,
Sure.
who who I knew from just being on air and being in New York City. I would see her on
Yes.
air.
Yes.
So and love following her also just to learn more, because even as a physician, I don't have that fund of knowledge about something that over half of our
Yeah.
population, half of the world's population goes through. And it almost just shows, I feel like, how devalued women's lives are, especially older women's lives. Like, it's almost like after a certain age, we don't matter at all, and what happens to us doesn't matter. And that's why what Dr. Malone was talking about, how like we're so used to suffering, especially as Black women, we're
Yeah.
so used to things just like being difficult, and we just sort of deal with it without the support and help that we deserve.
I appreciate that, and I appreciate your candor about that. We talk about that a lot, sort of amongst ourselves, and certainly on the Alloy platform. Dr. Malone, um, your book is like a blueprint. It's like a long prescription for the beginning of your reproductive years through your dying day. Could you spend a bit of time kind of highlighting for us what your prescription is essentially for a healthy perimenopause, menopause, and beyond?
The first thing that I say is just you need to recognize what's happening. And for a lot of women, they're clearly distressed because they're seeking, they're saying, my goodness, they're asking questions and everybody's got an opinion. You talk, you're getting advice from your hairdresser and, everybody's kind of weighing in on what you ought to do at this point in life. But I think that what you need to do first is recognize that you're in it, and that the process is not short. It can go on for as long as a decade, that transition
Right.
from your peak fertility years to actually get to menopause. Because we think of menopause as like, oh yeah, that's happening to old ladies. It's like, no, that transition is happening to 40-year-olds, 42-year-olds. So that's why I said, one, have the awareness. And two, the advice that I give to women all the time is that do not suffer. You do not get a medal at the end of this for having suffered for 10 years, 8 years down the road and not being able to function at your peak levels. And this is a really important. Perimenopause is a time in life when we're doing things, Dr. Blackstock's writing books. She's got small kids. You've got, you're trying to figure out all these things, and you can't really be functioning at less than 100% at this point in your life.
Mm,
So, what I would advise women to say is that once you realize I'm in it, I'm symptomatic, then understand that there is help. And it is simple. It is a matter of knowing what that help is. Because it's a hormonal problem, there's usually a hormonal solution. And let's be clear, it's not the answer to everything. Everyone should start instituting healthy lifestyle behaviors before you get to this point in life, clearly. So that's a given. But once you've done those things and you are still bothered and you are not functioning the way you want to do, then you go to your doctor, or you go to, if you can't find a doctor, then you come to Alloy. Because that's the thing that breaks my heart, is to see women who have suffered and who have suffered for so long, needlessly. And it's not just, quality of life, even though what's wrong with that? It is also that you're doing yourself a disservice because there are other long-term health implications of not getting treatment. The chronic
no,
stress, the sleeplessness, the weight gain, all of that stuff really has very deleterious effects on your long-term health. And who's at more risk for these things than Black women? No one.
right.
So, you're not doing yourself any good by
Right.
ignoring or minimizing symptoms, which is what we do as women generally. You're downplaying, you're taking care of everybody else. But I want you to know that there's a solution. You can get it. And if you can't find a doctor that really knows what to do, and I know it's a problem because whether you live in New York City or you live in Yazoo City, Mississippi, finding doctors who know what they're doing and how to treat and really, or empathetic to women
Right.
who are in
Right.
perimenopause is sometimes difficult. So that's why, we do what we do. After 30 years of practicing medicine, I realized, I was like, oh my goodness, after I left that part, I'm like, but I'm not done, because the need is still so great out there for
Mm,
educating women and making sure they get access to care.
Can I
thank
say one
you.
thing? Can I say one
Please.
thing? When Dr. Malone was talking, I was thinking about the story that Halle Berry has been sharing
Yeah.
publicly,
Yes.
and I
Yes.
got to meet her at the Time 100 event a few weeks ago, and she shared
Yes.
the story again, but about how she had met her current partner, Van Hunt, the artist, and she was dating him, and things were going great. And then she started having these, after they would have intercourse, this burning and discomfort. And she went to like her OBGYN, who's one of like the top doctors in LA. And he looked and said, I think you have herpes. And
Right.
then tested her. She went and told, her new partner was like, I thought you were the one. Like, she's like, I've been married 3 times. I thought you were the one, and now you're already stepping out on me. And then he's like, no. And then he got tested. She said he got tested. He was negative, and then she was negative for herpes. And then she said she went back to her doctor, and he was like, actually, oh, I'm sorry. This is, vaginal dryness, vaginal atrophy. And, so basically, even this person who's like one of the so-called top doctors in LA
Yeah.
couldn't recognize that his patient was having perimenopausal symptoms. Yeah.
Yeah.
You know,
Yeah. And I think ultimately, that does also sort of speak to and remind us about the lack of education in the medical schools, that this time of life that could last, 25, 30 years if you're lucky, menopause, you hit menopause, you go on another 30 years or so, is sort of this gaping hole of
Right.
information. I just want to, because I know we're going to wrap up very quickly, Dr. Blackstock, we spoke about the sort of micro and the macro. I want to bring it back up a minute. And Dr. Malone offers, sort of a remedy, a prescription, if you will, to women in perimenopause and menopause and beyond. And I wonder, without giving it all away, because I do want people to read your book, if you could offer sort of what you understand to be in many ways the remedies, the prescription to address disparities in equitable health care.
Yeah.
Just sort of home in on
Yeah,
that.
yeah. I mean, I think obviously there are the things that we've been talking about that happen on an interpersonal level when our
Sure.
patients interface with the healthcare system, making sure that we have health professionals who understand what's happening with them, can support them, value what they're saying, hear them, and then respond appropriately. But then, like systemically, we have to understand that Black women in this country, life is hard, especially for the average Black woman, who is working or taking care of her family. And so I think we need to think about, right, I say it's like health in all policies, like making sure that people have an opportunity for gainful employment, that they have paid family leave and sick leave, that they have access to healthcare that is culturally responsive, and that even in their neighborhoods they can live full long lives. Like that's what we ultimately want. And we know that when we look at the different factors, what we call the social determinants of health, education, access to healthy foods, employment, all of that is so incredibly important to making sure that Black women can live full lives, so that when they access the healthcare system, they're coming in healthier. They're coming in healthier, and then they're able to access a system that sees them for who they really are.
Thank you. Dr. Malone, could you share a bit about the positive, if you will, the positive changes that you've seen over decades
well,
for that reflect on us?
well, you know what? I'm going to be. I'm look since I'm the elder in the room. I will say this. The one thing that I want women to walk away from this is really with the notion that you know I'm menopausal and I've been menopausal for 15 years,
Mm.
and I don't want women to think, to sort of think that the expectation or the narrative of what happens after menopause is that it's something that is just fraught with decay and decline. It does not have to be. I think that this can be a very positive time in women's lives because it is the time
It
when
is.
you are finally freed up from some of
Yes.
the
Yes.
responsibilities, the day-to-day grind. And not only that, but there's a whole bunch of stuff that gets to this when you get to this point in your life that you just don't care about. So
Yes.
you are relieved of a lot of the societal pressures
Yes.
about what to wear and whatever. You do it for you. And
Right.
that's the point I want women to understand is think of this as really the second chapter of
Yes.
your life. I mean, think about this.
Yes. I
I
love that.
after and I'm as happy as I've ever been. I've pivoted. I found another career, another life that I didn't know I was going to have. And so think of it this way, the healthier you are as you sort of get to this phase of life, the better you're going to navigate the last third of your life, which is a long time. And so let's not enter this phase not being healthy, not having access to the care that we need, not having access to the things that are going to make us feel our best selves. That's what I want for women. And I don't want you to think about it as gloom and doom. No, ladies, it's great on the other side. I promise.
It is great. Dr. Blackstock, any final word?
No, this has just been really, really wonderful. I
It's
hope we
been
can do this
so
again.
lovely.
Yes, it's been a wonderful conversation. I also hope that the folks who are tuning in learn something that what Dr. Malone said, that we don't have to suffer, right? We have
No.
wonderful physicians like Dr. Malone out there that are educating us about this time in our lives. And I love the idea of like life only gets better from here on out, because that's how I feel. And I'm going to be almost 47, and I'm like, let's go 50s, let's go 60s.
Yeah, yeah.
I'm so excited.
Um, Finally, I do just want to say to both of you that you both sort of walk so certainly, so surely on this arc of dismantling oppressions and health education and dignity, and sort of shining a light on this holistic response to Black women's health from cradle to grave. And I just want to thank you both so much for this time. It wasn't nearly enough. I hope we get to do it again in
Yes,
some capacity.
absolutely.
Thank you for your works, both on paper, on air, on TV, and your relationships with us out here that you may or may not know, and certainly personally, we're all better for it. So thank you so much for your time
Thank you both.
today. Be
Okay.
well. Thank
Thank
you all
you.
for
Okay.
joining.
Bye bye.
Bye, 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 bye.
Bye bye.
Thank you.